Good morning, good evening, good afternoon, ladies and gentlemen. Welcome to our today's webinar on the understanding gambling addiction and its links to substance use disorders and mental health in Kenya. This is a webinar that is hosted by the Kenyan ISSUP chapter and of course under the ISSUP Global. For those who are joining, we know ISSUP is one of the global association that brings together professionals working in the drug demand reduction, prevention, treatment, as well as recovery support. I need to let you know that this webinar is being recorded and you will receive certificates at the end of the webinar in about 42 to 48 hours after the webinar. So the webinar is being hosted in Nairobi, Kenya. All the presenters are Kenyans. And to introduce our presenters, I am your moderator today, Catherine Muthiani, an addiction treatment professional, head of training, SAPTA, as well as the deputy president or deputy director, ISSUP Kenya. We have various speakers. One of our speakers was to be Dr. Mercy Karanja, who is the director mental health in Kenya, in the Ministry of Health in Kenya. But unfortunately, due to unavoidable circumstances, she's not able to join us. She's currently airborne. And we have had the pleasure of having Dr. Susan Gitau, former ISSUP Kenya Deputy President, Director Elewa Ulevi, as well as a Global Master Trainer, UPC, UTC, join us to step in for Mercy Karanja. Also, part of the panelists, we have Harrison Mwaura, an addiction treatment professional, as well as someone with a lived experience in gambling. We also have Crispus Kimaru, an addiction treatment professional, a recovery support professional, and a mental health champion joining us and is also internationally certified. So we have two sections of how we will go about this webinar. We'll take about 15 minutes to have Dr. Susan do a quick presentation to set the stage for the webinar. And then after that, we shall have a panel discussion where we shall have conversations around gambling addiction and its intersection. We are focusing on the Kenyan scenario, but there may be also some global perspectives that may come into place. So thank you very much, ladies and gentlemen. Please post your questions. We shall have some few minutes towards the end of the webinar to have an interaction of responding to some of your questions. Thank you very much. Karibu, Susan.
Thank you. Good morning, good afternoon, good evening to all our listeners, wherever they are coming from. I'm glad to be here. This is my 25th year as an addiction professional. I'm turning 25th in September of this year, so it's something that I'm very excited about. And I want to talk about gambling today. We say it's a risky behavior resulting in short-term rewards, which may result in persistent behavior over time and can be accompanied by adverse consequences. For this reason, it shares very many similarities and features with other forms of addictive disorders, especially substance use disorders. So I would define gambling as taking risky action in the hopes of achieving a desired result. Gambling is also referred to as betting or gaming. Now, in modern times, gambling has come to mean wagering money or and other belongings on chance activities or events with random or uncertain outcomes. Throughout history, gambling has involved activities requiring skills. We hear of professional gamblers. These are gamblers' knowledge of playing strategies which can improve their chances of winning, whether it's card games or in horses. However, it comes with health concerns. If you look at DSM-5, it tells us that gambling is a disease. This is one of the most insidious human vices, as it presents the illusion of easy money, yet can quickly lead to financial ruin. The odds are never in your favor, whether it is poker, blackjack, or anything else. Here in Kenya, we have heard where radio stations have been telling their listeners to keep betting on and bringing the one person who wins many times so that others can believe they are winning. But we know gambling is a successful industry because the house always wins. We have different types of gambling. We know it's a diverse activity, so different types of gambling addiction exist as well. It is not always obvious when someone is addicted to gambling, unlike substance use or alcohol, where you can physically see this person. With gambling, because people hide a lot, so it is no longer restricted to the slot machine, cards, or casinos, or even purchasing that lottery ticket, or entering a raffle, or making a bet with a friend. The e-gambling is here, the e-sports. In Kenya, we have something which has really devastated our community, where people have opted to use a small plane. They are calling it avatar. And this is very, very addictive. And a lot of people have even died out of a depression, and then they commit suicide. So we know gamblings are many. Now, when does it occur? A person might feel that they are in financial ruin, and they feel the only way they are going to solve their problem is by gambling the little that they have, hoping that they will get large amounts of money. Sometimes they are gambling, they need to escape from their daily stresses, so they are using gambling as a way of killing time. We have noted these can resort to mental health disorders and challenges, such as anxiety, depression, impulsivity, oppositional behavior, high cessation-seeking behavior, and conduct disorder in adolescents, and low resilience. Now, how is our environment here? We do have a lot of casinos within Nairobi and out of Nairobi. Horse racing events, they still occur. Some people are betting on the motor races like the Safari Rally, other games, but the radio shows, because they are able to reach even the oldest person in the village at the grassroots. So the radio shows have been the most active and the ones who have really messed our people. I will keep saying the house always wins. And that is why they will keep on doing it and doing it, as this is a way that they are making money. This almost always leads to a cycle in which the gambler feels they must win back the losses. And the cycle goes on until the person is forced now to seek rehabilitation to break the habit. What is causing gambling? There are many factors. One is desperation for money, the desire to experience the thrills and the highs, the social status that are associated with being a successful gambler, the entertaining atmosphere of the mainstream gambling scenes, the casinos, the way they present themselves, the way they hype it and make it look very classy. This, and of course, the technology advances that are here with us in today's culture, and the excessive use of our smartphones. We also have the social cultural influence of friends, peers, groups, family, and the broader culture. Unfortunately, once a gambling addiction takes hold, breaking the cycle is very difficult. Severe addiction can take hold when someone feels desperate financially and wants to make a comeback for what they have lost. In our social culture courses, we have something very interesting in some communities where there is bullfighting. People bet, including cockfighting, donkey racing among certain communities. So there are those people who are doing them now in the village and putting it into a cultural format. And it's something that is really accepted, but the betting still goes on. How do you know you have a problem? If you feel the need to be secretive about your gambling, then there is a problem. If you're having trouble controlling your gambling habits, gambling becomes the most important activity in the person's life and dominates the individual's thinking and behavior. So they don't have anything else. When gambling, you cannot even afford to, but you find that you are feeling the need to increase the time, spend, or frequency on the gambling to achieve the desired results. It even changes your moods. It affects how you feel. Your friends and family start expressing concern about your gambling. We know gambling causes interpersonal conflicts, conflicts at work, socialization, hobbies, and even your own personal interest. The hallmark of the gambling problem is that you feel you cannot stop. You feel like you need to try just one more time, or you feel anxious when you think about quitting. Mood modification, so that the individual uses emotional impact of gambling as a form of psycho escape or as a means of arousal or avoidance of unpleasant effects. Now, the emotional symptoms of gambling. We have noticed excessive gambling often causes multitude of emotional symptoms, including anxiety, depression, suicidal thoughts and tendencies, sleep deprivation, weight gain or loss, acne and dark circles under the eyes. We are also noticing that gambling frequently results in other addictions. We have heard of people who are cross-addicting, from maybe alcohol and substance to gambling or to sex addiction or to pornography addiction. So we realize that gambling can be something that can be cross-addicted. Other people stop using as alcohol and substances and they fall into gambling. But I've noted in my career that a person who has addictive disorders, if they stop one thing, very easily they fall to the next big thing. In 2020, when COVID came, this is when the radio stations really put on the gambling, the betting stations. And people were anxious here. People were depressed. People were having so many feelings that they were going through because of COVID. And some ran to feeling better, hoping that they would win now that people are not working. So we notice that many gamblers can also turn to drug and alcohol and other activities to alleviate the anxiety that is brought in by the gambling lifestyle. Is there a test I can do? So for those who think they may have a gambling problem, ask yourself whether you'll be okay if you stop gambling right now. If you feel anxious or if you shouldn't stop yet, chances are you are suffering from a gambling addiction. While gambling cannot be directly treated with medication, it is possible to alleviate the anxiety and depression that results from gambling and that often leads it in the first place. So the most common way to treat gambling is with medication, where psychiatrists prescribe anti-anxiety, antidepressant medication. Feeling depressed and anxious often exacerbates gambling addiction. Now, because gambling addiction is often associated with depression, we need to watch out for these signs, whether it's you or your loved one. Lethargy, fatigue, change in appetite, unhappiness. These are some of the symptoms that you would note for one who is suffering from depression. And we know depression is often not something that can be controlled easily. It needs medication and psychotherapy combined. So, how do you get help? Quitting gambling is not an easy feat, but it can be done with the help of solid support group and treatment programs. It can be difficult to get started on the path of recovery without the assistance of professionals who have helped people through the process before. Supportive friends and families are vital to a full recovery, but they might not know how best to help you. So I would want to stop there and thank you so much for listening. Back to you, Catherine.
Thank you very much, Susan, for setting the stage for this conversation this evening. Some things that you are able to bring out in your presentation is you kept on highlighting on why people keep on gambling and that people are chasing the losses. You emphasize on the fact that the house always wins. You're also able to highlight some of the connected mental health conditions with gambling, including anxiety, depression, and such, and talking about the impairment element, which makes gambling a concern or something that people should diagnostic criteria of what a mental disorder will be. But people will keep on gambling despite the negative consequences. But then you've also given us some of the effects that people experience when they gamble. And because our conversation is on the intersection between gambling and substance use disorder, maybe you can just briefly share with us what is the connection? What are the similarities between the two? What would keep somebody going back again and again to gamble despite the losses?
Thank you, Catherine. We are aware
Did
of
you?
the addictive. We are all aware of addictive disorders, and we know that they use the same pathways, whether it's substances, whether it's a behavior. So it's the same pathways where dopamine is released in your brain. So this person is looking out to feel the rush, to feel the high. That is what they are looking for. Interestingly, in gambling, whether you lose or win, they still experience the high from the dopamine. That is the most interesting thing. Initially, I had thought that when they lose, the dopamine will not be there. But the thrill, that waiting, it still pumps a lot of dopamine to them. Therefore, you will find that they will keep wanting to feel this high. The same way somebody using alcohol or substances, when the high goes down, they will still want another high from the same behavior. So that's why it becomes very addictive and becomes something they are doing in a way of coping. Incidentally, most people are having other issues, loss and grief. They don't know how to handle that, they go into gambling. People are having trauma. They don't know how to deal with it. They want to distract themselves. They go into gambling. Others have had bad experiences. And they are also hoping that they will get quick money without really doing much. And this is something that has been sold by the people who are in the field of gambling or betting. So they have a way of convincing people that you can make quick money. And everybody wants to make quick money without really doing much. So that is how it has caught up with our people here in Kenya. And we know that at least for the last 1 month, out of a lot of people lobbying, we managed to have a lot of stations that were betting being closed, which has been very good. Now you can listen to the radio without listening to all those issues that were Kelea, put this here, add here, do this. So that has really been a relief to most of us Kenyans. Thank you very much.
Thank you very much, Susan. Before I go again to the next speaker, just tying and riding on your statement of the house always wins. Does that tell us that the gambling industry understands the psychology of human behavior and the issue of reward?
Definitely they do. They do that very well. And if you see what they do when this one person wins, they will keep hyping this one person who has won so that others may say, next time it will be my chance to win. So they have a way of hyping the society or the community so that it will keep believing, I will also win. It's just a matter of time. And we know the house ultimately is the one that is winning. So it's a way that they have understood the psychology of the masses, and that's how they are making their money. Thank you.
Thank you very much, Dr. Susan, for those insights. And now let me invite Harrison. Harrison has a lived experience with gambling, but as he gives us his story, I would also like to have him tell us what would be some of the factors. I know Susan has mentioned some of them, but what would he say are some of like the current factors that are contributing to the number of young people or the number of many people who are engaging in gambling in Kenya? I was looking through the statistics and it was showing that about 82.8% of Kenyans are gambling. That's quite a big number. And Kenya, looking at Kenya in Africa, is leading in gambling. So, Harrison, please share with us how your experience has been and what you'd relate to these statistics. As I wait for Harrison to come on board, let me have Crispus. Crispus is an addiction treatment professional. He's also a recovery coach, and he's been working with persons struggling with gambling. And probably, Chris, you can give us some highlights. What have you seen? What are the different presenting issues that persons struggling with gambling are coming with?
Thank you, Catherine, for the opportunity and also for the ISSUP fraternity for this opportunity. Maybe before I answer that, I can give a background of why I'm here and why maybe I'm a panelist, because I have a lived experience with gambling, and for me it's unique because it started when I was about to start my recovery from alcohol addiction, and so I was using gambling as a way to restore what I had lost. And as Dr. Susan has said, many people end up in addiction, in gambling addiction, because of they think that they can get rich, and I was one of them. So I was basically trying to recoup what I had lost during my alcohol addiction. And what started as fun initially in 2017, by 2018, mid 2018, it was a serious problem. I started betting using maybe less than 100 shillings or maybe less than $1. And it got to a point where I was using even 20,000 on one single bet for me to maybe recoup what I had lost. So all the symptoms that Dr. Susan was talking about, chasing the losses, they were there. By 2019, I had broken all the relationships in my life, and I had chased off my girlfriend then, because I wanted to start selling household stuff. I sold the refrigerator, I sold the seats, I sold the television because I wanted to sustain this. And you see, being a person in recovery initially, I was in a depressive mood. I was bored. I didn't have a lot to do. I didn't have hobbies. And so, anxiety, gambling gave me that kind of a high, and it felt so good initially that anytime I would place the bet, there was this anticipatory good feeling that I would win. And even if I lost, just like the presenter has said, and even if I lost, it still felt good. And it didn't matter the amount, whether I was placing a bet of 10,000 shillings or even 50 shillings, it didn't matter. And it got to a point where it was controlling every aspect of my life. So, Catherine, you have asked what are some of the presenting issues. One of the main issues that we are seeing, especially with people struggling with gambling addiction, is the loss of control. Just like myself, initially I knew what I wanted and I had the money. I knew what I wanted to place. I would place maybe 50 shillings or maybe $1 or something like that. But at the end of the day, by the end of 1 year, 2 years, I was placing so much. And it didn't matter whether I had the money, I had to get the money. So I started conning people. Those are some of the symptoms I'm seeing with many of the clients who are coming. I started lying to people. At one point, I was lying to people that my dad was in hospital. Yes, he had been in hospital, and I had the photos. So I would send out the photos to people and tell them that my dad is almost dying so that they can send money. And whatever amount came to the phone, whatever amount came to the mobile app would immediately go to the betting website. It was there was that compulsion, just like with the substance addiction. There was the compulsion and the loss of control. Those are the two things that that I'm seeing with most of my clients. Then the broken relationships, of course. Gambling, like any other addiction, kills the relationships. I had lied to everyone, and I had started a very good business. I was branding t-shirts, but I messed it up because I remember one client paid almost 200,000, and when the money landed in my mobile app, I took all that money and uploaded it into the gambling website. And I'm telling you, within a night and the next day, by 5 p.m. the next day, I didn't even have a coin. And this was clients' money that was supposed to maybe produce some branded supplies. So there was a broken relationships, financial mess. There's the loss of control and the compulsiveness. Those are some of the things that we are seeing. And then, of course, there is the cross addiction to substances. Because of the anxiety, I'm seeing many of the clients who are coming in with gambling issues. They also have dependency issues with the substances, mostly weed, mostly cannabis, because it kind of helps them calm down from the anxiety that they are suffering from. Maybe I don't know whether I've answered that comprehensively, Catherine.
Um, Thank you very much, Chris, for sharing your own personal experience and personal story, just to highlight how gambling can enslave someone. And two things I've taken away: compulsivity and the loss of control because of gambling. And then there's something you've mentioned about money landing in your mobile app, and immediately you would place it on the websites for gambling. Would you say that is one of the contributing factors that has led to escalation of gambling in the country?
Yes, the ease with which you can gamble. Today morning, as I was taking my son to school, we were walking, and ahead of us were high school kids, and they were talking about Aviator, the same game that Dr. Susan has talked about, and they were saying how one of them was telling the other how addictive it is, and they were speaking in Swahili, and all of them agreed. They even said it was like witchcraft. It is so easy even for kids who are 10 to gamble. It is across any internet platform. If you have money in your bank or in your mobile app, you can start gambling. And on TV they even advertise that you don't need even any gambling experience. You don't need to know any sports. You don't need to know football or to have played tennis. I remember when I was gambling, I even used to bet on horses, bet on basketball, and I don't even know anything about those games. So the ease and the availability of internet and all these gadgets, internet technology, it's all across. It's accessible even to kids. So the ease makes it so easy. I think it exacerbates the problem.
Thank you very much, Harrison. And getting back, sorry, Crispus, and getting back to Harrison, again, another gentleman with a lived experience in gambling. Crispus has just identified to us the ease in which money is transferable from mobile apps into gambling sites. You also have your own story. And probably in your case, you may have had a different experience of some of the contributing factors. So just inviting you to tell us, how was it like for you what factors contributed to it? Would you say your gambling was progressive, just the same way we say addiction to substances is progressive? Over to you, Harrison.
Thank you so much, Catherine. I really appreciate this opportunity. And as we were sharing about gambling, I was really remembering how it used to happen, how I used to gamble. And for today's topic, we are talking the link between gambling and substance use. And in 2016, I had just been out of rehab, and I knew that alcohol was never for me, and I completely quit alcohol. And for the next 4 years, this is from 2016 to 2020, I never tasted any alcohol. But I was introduced to betting, and that was, for me, it was specifically sports betting. And first, I remember I placed a bet of 500 shillings, and I won 21,000 Kenyan shillings. And I remember I was able to shift from a bed sitter to a one bedroom, and my wife was really happy. So, considering the statistics that we are talking about, I was looking at the statistics, and it's quite worrying. Kenya, we are ranked number 3 in Africa. We are almost 17% of the population have ever placed a bet in their life. So the statistics are really worrying. And according to the statistics, what makes it really high in Kenya is, as Chris was talking about, is of easy accessibility. I myself was a teller in a bank, and easy accessibility and availability of the gaming platform. Initially, we could all walk into casinos, but at the comfort of a teller, where I was serving customers, on my laptop, one tab I'll be serving customers, and the next tab I will still be, I'll be betting, looking at the games to place. And of course, there is accessibility to money. I was serving customers, and I had, of course, the bank money at my disposal. At my disposal. You can imagine, I was taking the bank's money, depositing to my phone, and putting them, or sending them to the betting sites, and I would bet and bet and bet, and to my surprise, it is the same things as we talk about the alcohol addiction. You see, when talking about the stages of addiction, we talk about the experimental, social, instrumental, and habitual. And one thing about the habitual stage is their blackouts. There are instances that you see the way you take alcohol and you forget everything that happened. You have a memory loss. Still in gambling, I would forget the amount I've placed in bets. I remember at one time the auditor came and I had a debt of 600, and these are the consequences of the financial rules that happened. I had a debt of 600,000 Kenyan shillings, and I did fraud and so on and so on, and the auditor did not. Was not able to detect, but moving forward, I had accumulated debts of close to 2 million Kenyan shillings because of how easy accessibility was. Another factor that leads to that was really affecting that causes the high rise in statistics is the unemployment and of course the financial stress. By then I had a young family. The burden was too much. I was living in a Bensita, but because I had tasted gambling and I had known that I had the experience that I would win money. Placing a bet of 500 shillings and winning that much, and I really elevated myself to a one bedroom. I earned money, but because there was so much, I really continued playing. But the more I played, as Dr. Susan said, the more I continued losing. I remember at one time I had won 224,000 Kenyan shillings. But by the end of the day, the only thing that I bought was a chicken worth 1,000 shillings. So all the other amount, I had to send it back to the betting site. So the cycle continued, and because of the peer influences as another factor for the rising statistics, it was really taking a toll on me. And of course, the aggressive marketing by the gambling companies. As I remember, the other day I received a phone call from one of the betting sites. I don't know whether they have our numbers or still they still think that I'm a real customer. They were calling me and they were telling there's this company that were giving the discounts and so on. So the aggressive marketing by these gambling companies is really affecting our society. Is really affecting everybody, and they're doing it quite often, and without even shame or without even knowing the kind of harm they are causing to us. And of course, the lack of awareness and regulation. And initially, we had talked about much gambling, and we thought that gambling was such a game for fun. The way you go and play a pool table, the way you play cards for fun at home, and we always think no more because people haven't realized that this is a disease. And lack of awareness. I remember one time when I won the 21,000 Kenyan shillings. My wife was very happy that gambling had elevated us from a bed sitter to a one bedroom house. So she will really encourage me to continue betting, and she will say how her husband is a pro in betting. So it was because of lack of awareness. It was quite much. But of course, the ruins that happens later, they are quite much. Of course, I ended up losing the banking job. I ended up losing that family, and I had invested in a good executive barbershop, and I ended up selling all those items. I remember there was a barbershop seat that I had bought for close to 40,000, but I remember I sold it for not more than 3,000 shillings because of all those consequences of gambling. So the statistics are, the statistics are there, but the statistics are not just numbers. These are people that are losing families. These are people that are losing jobs. These are people that are caught up in a circle like myself. Yes, so thank you so much, Catherine. Over to you. Over to you,
Thank you
Catherine.
very much, Harrison, for highlighting, the kind of causing factors that contribute to people engaging in gambling. And as you were speaking, it just reminded me about the progression of gambling. You would say that immediately after you left treatment, because you knew you couldn't have a drink, what you needed to do was to find an alternative, and someone introduced you to gambling. And there went the win. And of course, this started to look like it's something nice. And this, I want to take it back to you just a bit before I invite Crispus. Do we have different types of gamblers? Do we have gamblers that never lose?
Yes, thank you so much for that. You have really reminded me of such a point. But the reality is, gambling happens in phases, and the first phase is the winning phase. At the beginning, you definitely have testimonies of people winning, but as you cross to the second phase, which is the losing phase, now you start losing. The losses are more than the wins, and after that, you will progress to the depression phase. And in the depression phase, you will experience anything to do with the symptoms of depression, loss of appetite, anxiety, feelings of suicide. All those issues are there, and at that is of course hopelessness. I will say depending on the disease is the same, but how you progress really matters. Maybe depending on the frequency of betting. But at the end of the day, most of us are in denial. Most of us are in denial. It is the same case of alcohol. It doesn't matter the type of alcohol you are taking. You are still an alcoholic. Of course, the types of alcoholism, but still in betting, there are different form of betting. As long as it's betting, there are those of us who bet the chance, as Dr. Susan talked about it. There are those of us who bet on chances, something that you don't have to have the wit. There are those of us who bet on knowledge, on your expertise in football. There are those of us who bet on the legal and on the illegal betting. But at the end of the day, all of us are pathological gamblers. But I will say this as Dr. Susan. Yes, it's okay. Thank you so much. Over to you.
Thank you very much, Harrison. As you speak, the picture that you're painting about gambling and the progression, right from the initiation to the winning phase, to the losing phase, to the desperation phase, it sounds more like addiction to substance use disorders. Dr. Susan, you highlighted to us some common mental illnesses that may occur together with
Mhm,
gambling.
mhm.
But is there also a possibility that this could also, beyond the mental health condition, is there an intersection a bit with physical health? And you can also tie that to the impact on the families.
Thank you, Catherine. Definitely, when it comes to physical health, you realize that most gamblers, and I've liked the way Harrison and Crispin are bringing it up, they become pathological liars. So they will lie constantly about my mom is dead. I have a case where a young man actually posted in a WhatsApp group that his mother was dead and his mother was alive. because of gambling. So people were, Kenyans, they were sending money. By the time the father knew about it, he had already raised 70,000 on his app. What I noted with most of them, they become very stagnant. They don't walk, they don't do anything. They want to stay alone in a room. They don't want to associate with people. They don't want to eat. So physically, we can say they're also seriously affected. The family is the most affected when one is gambling. Remember, the resources that this person could be bringing to his or her family are now being siphoned towards gambling. I've liked what Crispus has told us. It is now on the phone, meaning you can gamble 24 hours. If you are not sleeping, you are gambling. If you're alone somewhere, even when you're in the toilet, you can gamble because you have the phone with you. Those apps are here with you. Knowing that Kenya, we are an M-Pesa country. Any little money you get on your M-Pesa, you use that. So the family actually suffers a lot, whereby this person hides. Rarely does somebody come out and say, I have a gambling problem. And unlike alcohol and other substances, where the family members are able to see and say, Susan is drinking alcohol, Crispus is using marijuana, they are not able to see that sign. The only thing they'll be wondering, why is this person demanding so much money, but we don't see where the money goes to? Nobody seems to understand. And they have a way of conning everybody around them and then more. So the families, and some children are not being educated. They don't even have food. Some are being thrown out of their houses just because somebody is gambling. And this person is hoping in his mind that I'll still win and catch up. When it comes to types of gamblers, we have three types. Broadly looking at them, we have what we call the professional gamblers. These are people who actually make a living out of gambling. They are there. Then we have the social gamblers. These are people who have other businesses, but they kind of just socially, they say it's a way of recreating. And then we have now the problem gamblers. And I think those are the majority that we have here in Kenya. So broadly, we can look at three types of gamblers, and they are the professional, the social, and of course now the gambler that we are talking about today, who is a compulsive gambler. Thank you, Catherine.
Thank you very much, Dr. Susan, for those insights, and you're responding to some of the questions being asked on whether gambling requires skills, and the highlight of the different types of gamblers alludes to that. But then Harrison, Crispus have shared their experiences, and then the question begs, do we even have programs in the country and beyond that are addressing gambling? How did you recover? How did you overcome your gambling? I guess I would like to know about that. What are the treatment modalities? What are the interventions that are there? How are we doing? Crispus.
So for me, recovery was a personal initiative. There was no one to help me. It came from my fiance, and that's because I was caught. I was caught gambling, and when she caught me, the only thing we could do was for me to open up, tell her that I have been gambling, and she became my accountability partner. We didn't know anything about anyone who could help us with the therapy or anything like that, and that's one of the biggest problems we have in the country. Over the last 10 years, since gambling was the marketing frenzy started, the government has not said anything about gambling. BLCB never said anything about gambling, and that is the body that deals with maybe regulation. There was no one talking about it until maybe 5 years ago, when one of the cabinet secretaries tried doing something about it. But even when they were trying to stop, there was no talk about treatment for the people who are already in addiction. And you find even today, we don't have even a policy, a government policy on maybe from the Ministry of Health on how to treat people with a problem gambling. Last month, when after so much advocacy by people like us and Harrison and the others, after so much advocacy, the government first said there was no problem, and then the ministry later said they came up with a task force about how they are going to help. So today we can't say we have structured programs, but we have addiction specialists, people like us who are trained. We have programs such as the ones by I saw SUPTA, where I'm also a trainer. They have a program where they are training people in gambling, counselors who want to help people in gambling. We have those. We have rehabilitation centers in Kenya that deal with addiction. Now they are expanding. We can say they are expanding. And most of these are privately owned. So it's not a government project per se or a government policy. So the rehabs, they are doing that. Then we have addiction counselors who have already specialized in gambling or addiction, or any forms of addiction, both substance addictions and process addictions. So those are the ones I can talk about. But I can't say that there is any modality from the government. They just talked about a task force, and they are going to do something collaborative, but nothing has been forthcoming so far. So for anyone struggling with gambling today, it is a personal initiative. They have to reach out. We are even telling them when we talk in public that they have to reach out. They are the ones to reach out to, maybe those who have been through it, or those who are trained to help them out. Thank you, Catherine.
Thank you very much, Crispus. So, from your experience, is that it had to be a personal initiative. This was a self-directed initiative for you to be able to um, get the kind of help and recovery that you so needed. I wonder whether the story was the same for Harrison. Harrison, how did you get help? Were there programs that you attended? And as Crispus said, in April this year, our Ministry of Health declared gambling as a silent epidemic in our country. And that's when the task force that Crispus is talking about came about. Where are we? How did you get help? Where can you direct persons struggling with gambling in Kenya? And also for the professionals who are listening.
For me, just like Chris, my help came from both internal and external factors. I remember after being fired from the job, after losing my family, after being evicted and being homeless because of betting. My help came because of rehabilitation. I was taken to a treatment facility where I stayed for 3 months, and I underwent the program of counseling and all that. But I will say by then there was. Then people wonder why did this guy lose all this money? So for me, I'd say it came out of personal willingness and seeing the amount of ruin I had done for myself and both for my family. So mine was both internal and both external from my family. So family support really played a great role. Why not for my family? Today it will be a different story. I'll probably be jailed behind bars because of that. Over to you, Catherine.
Thank you, Harrison and Crispus for that response. So it's quite entwined in the sense that when you are gambling, the family was suffering. But at the same time, for you to get into recovery or for you to start making changes, it also took family to contribute to that. And as Dr. Susan was presenting, she mentioned that gambling, sometimes people will suffer in silence. What would be the form of stigma that persons struggling with gambling would experience at family level and even the persons who are struggling? Susan, you can respond to that and maybe to connect to your presentation on some of the interventions that you talked about for evidence-based intervention. You connect stigma, family support, and the treatment modalities and approaches. Do we have EBPs for gambling?
Thank you, Catherine. Currently, we are aware that we have Gamblers Anonymous in Kenya, and it has been there for quite some time. For those who have been in the field of addiction longer, we've had short trainings on gambling, and we have been support system to those people who have been suffering in gamblings. Of late, we are having institutions that are teaching on gambling and therefore bringing in the evidence-based practices for people suffering in gambling. The stigma is big, because even the family members do not understand why a father or a mother or a sibling would be wasting money. For them, that is wasting money, and they are already seeing that it is not working. So the stigma is normally very bad, where somebody now is denied any amount of money. They don't want to be associated with them. They tell all the family members, please do not give so and so money. Never allow so and so to have any kind of money, because they will go gambling. And of course, gambling, culturally looking at it, some people even would say you have been bewitched. They don't believe that you can be having a problem of gambling. And as we talk about gambling, we realize it also has stages, like the way you explain for addiction, for alcohol and substances. The winning stage. And Kemaru was able to tell us how he won that winning phase, and where the wife felt that they should gamble more. Is that Crispus who thought that way? Then the second stage is the losing stage, where now you start losing money. And at this point, you are trying to get back to the winning phase. And that's where you are now losing money. The third stage now becomes the desperation stage, where now nothing is working. You are no longer winning. You are continually losing. You are borrowing money from left, right, and center, from other apps, loan apps, from banks, from friends, from family. So this desperation stage is one where the person now starts showing signs of depression and anxiety. And of course, the last stage, and this is the hopelessness stage. And this is where most of our Kenyans had reached, and they committed suicide because they had reached the end of the line. So those four stages are the ones that come with gambling. So when you're interacting with this client as a therapist, you need to know at what stage are they at. And therefore, you use cognitive behavioral therapy, which is mostly used in gambling. So do we have people around who can help us with gambling? Yes, we do. Thank you for allowing me this time to interact with people.
Thank you very much, Dr. Susan, for the highlights on what is there, what is available. I'm looking at the questions raised, and there's this question: do we have Gamblers Anonymous group in line to treatment and support for persons struggling with gambling? And I've just seen a response there that says that somebody. Somebody has started an anonymous gambling group that is supporting such persons. Ladies and gentlemen, you can keep on posting your questions on the chat. We are responding to them as we continue. Harrison, I don't know whether you have something you want to say before I start picking the questions.
Yes, thank you so much, Catherine. It's really encouraging and great to hear that people are really opening up. And I would say the impact of families is was so much on my side, on the emotional trauma and of course the mental health. There's a period that I started neglecting my child, my own child that have lived even after my own father. I started neglecting my wife and so on and so on. And it was so much. It reached a point where there became now the financial ruins. I started selling household. I started neglecting even the bill payments. And of course, that's where we have the role reversal. Just like in substance abuse, the role reversal. I remember telling my wife, I'm not able now to pay the house rent. Now you can be paying the rent. And it went on and also until I was evicted because of that. What about even the impact on the child development? My child was really affected in terms of academic, in terms of low self-esteem. And I could remember instances that my child, I would hold my child on the shoulder when my phone was still on the hand, looking for bets, looking for the sports matches to talk about, and to maybe to place bets on. And as Dr. Susan still talked about the mental issues, there's a period that I felt like I was depressed. I was isolating myself in the bedroom, and my family was really concerned. Why this guy really isolating? Why does he take his food and still go to his bedroom to eat there alone? All the symptoms of depression, as Dr. Susan had talked about, and of course. And of course, now the risk for addictive behavior, and I became so addicted in betting. Just like Dr. Susan had talked about recovery, and regarding all the principles of all the principles of recovery, that recovery is real. Today, I'm one person who have really recovered from betting. Today, I can count around 4 years, 2 months, and 3 days away from betting, away even from all substances. And I have been able to restore everything. I restored my family, and by August, hopefully, I'll be graduating with a master's in counseling psychology. So I will say that recovery is real for anybody who is lost in gambling, for anybody who is lost in betting, for anybody who has lost. I will say there is hope, and you can recover just like myself and Chris. Thank you so much. Over to you,
Um,
Catherine.
Thank you very much, Harrison. And just to pick some of the questions that are being raised here in the chat, someone is asking, do people experience withdrawal symptoms just like the way it happens in addiction to substances? Chris, did you experience any withdrawal symptoms? And you can respond to two questions together. What is the risk if somebody starts to gamble early? We know in addiction, when people start to use substances early with an underdeveloped brain, the risk of developing addiction is quite high. Could we speak the same as far as gambling is concerned?
Thank you, Catherine.
Discuss.
That question is very thank you, Catherine. That question is very relevant. The withdrawals are real. We said, Dr. Susan said, this is like any other addiction. The reward pathways are affected. The dopamine pathways are affected. So if you are not gambling, if you are used to gambling and you don't have the money, that's the point where you become agitated, you become angry, and it changes. You see, for someone who is placing bets on a football game is 90 minutes. When for instance they are winning, they are very happy. By the time the game is ending and they have lost, they are so angry. Within the next 20 minutes, they are not even talking to you. They are moody, they are agitated, they are irritated until they get more money to place a bet. And like I said initially, it doesn't matter whether you are placing a bet of 20 shillings or 10,000. You just need to place that bet. So I remember there were times I would wake up in the morning at 4 a.m., for instance, because I was not able to sleep. At 4 a.m., and I'm sleeping because there are no games to bet on. So at 4 a.m., 3 a.m., you are waking up so that you can bet on a game from Australia or Japan, the countries that are already awake. That is how bad the withdrawals can become. And sometimes you might not shake, but you are so anxious you can't even focus on any task. I used to do online writing, but I would not even start. I would even beg for my fiance for 100 shillings for me to go down the apartment, 6 floors, to go and deposit that 100 shillings. Then I can come back to the house and place a bet. Then we would have a conversation. It's that bad. I have seen guys locking themselves in the house. People who are employed, they have even quit jobs because of the withdrawal effect. They can't even sustain themselves in the office. They are so anxious, they are so moody. They get warning letters, just like you struggle with any substance, with any substance. Okay. On the second question, I've lost it, Catherine. The second
Um,
question,
the,
please.
sec- the second question was on whether the risk of starting to gamble quite early, like the example of those kids that you were talking about in the morning, talking about Aviator. Um, what is the risk when people start using early in regard to that developing brain?
Yes, there is a high risk. Like with any other addiction, their brain is not fully developed until they are 25. And with addiction, it's even worse because of the anticipatory dopamine surges. You see, with gambling, unlike alcohol and any other substance, there is that anticipation that you are going to win, and that messes up your reward circuitry. So by the time a kid who is 14 or 15 starts gambling, the anxiety level with time, the anxiety levels are so high that they will easily become hooked to these to gambling. They are easier to get hooked or to get addicted to a substance than maybe somebody who is starting later in life. Okay, just like it happens with in any other addiction. We have seen kids in the universities getting to a point where they are even dying by suicide. They are harming themselves. They are killing themselves because of them, because they are getting addicted so easily. And that's why the marketers are even targeting specifically the younger kids, because they know it is very easy for them to get hooked. It's easier for them to learn such behaviors and get hooked. So maybe that is even where we are supposed to target the preventive, maybe preventive, focus on prevention now. Thank you, Catherine.
Thank you very much, Chris. Quite some insights that the panelists are presenting. Unfortunately, we did not have so much time. This is a conversation that really needs to continue as we talk about issues of gambling. And as we've seen, it's not just a Kenyan problem. I've seen a couple of people identifying that it's also a concern in their own countries. And we need to prepare ourselves, both preventive as well as treatment measures. And as we wrap up, just to get one round of responses of your own closing remarks as far as gambling is concerned. There has been a question about the change in brain structure. I think a bit that of it, Crispus has responded to it. But there is a question that is keeping on popping up. Are there screening tools for gambling? What are they, or should we need to further and get training? Susan, you can tie that as you share your closing remarks. And I also give time to Harrison and Crispus to share their closing remarks.
Thank you. I've only seen one mild, very mild tool, which asks, I think, is it 4 or 5 questions about gambling, just to know whether you have a problem. So I think we need to do more, or even make our own tools for us to be able to do that. My closing remarks is like any other addiction. Gambling is here with us. And as a country, we are aware of how much damage it has done to our people, where they are cross-addicting from substance to process addiction or to gambling or to other addictions. But gambling take it all, because the radio stations, the TV, those smartphones, they are all over encouraging people to gamble. And we have all learned that the house always wins. Thank you.
Thank you very much. Over to you, Harrison, for your closing remark.
Thank you so much, Catherine, for that moment. It was really interactive. My end session will be to say that gambling. I always say it is not a financial. It is not a financial thing, but I say gambling is an emotional problem with financial consequences. And gambling doesn't just affect the wallet; it damages the minds, it damages relationship, and of course communities. But my closing remark will be: recovery is possible. Recovery is possible, but the impact can be long lasting unless we act early and with compassion. Even if we have recovered, there are still other things that we are going through. Of course, we have broken marriages that from our previous relationship and so on. So I would really encourage maybe the government to really act on the policies. And I'm one person who is not always an advocate for responsible betting. I'm a responsible gambling, because how do you tell a person who is already addicted that they should bet responsibly? These are persons, once, just like Chris was saying, once you place the first bet, the cycle will go on and on and on and on. I hope we have just started the process, we have just started the conversation, and we will make a difference in this generation. Thank you so much, Catherine.
Thank you, Harrison. Over to you, Crispus.
The house always wins. No one has ever gotten rich out of gambling, and this is a mental health disorder. It's even in the DSM-5 TR, and as for those professionals who are here, please, when we are diagnosing, let's not forget the link between gambling and other mental health disorders, like, or other mental health issues like anxiety, because in most cases that we are getting, there is that correlation between gambling and anxiety. There is so much anxiety around the whole problem of gambling. So if you're able to deal with the anxiety and tackle anxiety, it becomes easier to help your client to get out of it. And Harrison can maybe concur. The moment you start dealing with the anxiety, it becomes easier for you to even stop betting, because you are even betting when you are so anxious, you're even shaking. Once you place the bet, the anxiety goes down. So if you're able to get other coping mechanisms, or then it will be easier for you to quit the bet. Thank you.
Thank you very much, Dr. Susan, Harrison, and Crispus, for taking time to give us insights on gambling and giving us some insight on the connection between that and substance use disorders, not just theoretically, but also with lived experiences and the space, some conditions, mental health conditions like anxiety, depression, may have a place, making people to be more vulnerable to developing a gambling problem. As Susan highlighted in the spark of gambling during the COVID-19 time, that was an anxiety provoking moment for many persons globally. So, as professionals, this could be the new pandemic that we are looking into, and conversations like this keep on empowering us. Look out for trainings that are available to learn more on gambling. The house always wins, as we have heard. Ladies and gentlemen, that's our webinar this evening, or morning, or afternoon, depending on where you are. Once again, the webinar was being recorded. I've seen people asking whether certificates will be issued or whether they will get a recording and the presentation. The recording and the presentation and certificate based on your attendance will be shared to you. We were able to have this webinar courtesy of ISSUP. Thank you very much, ISSUP, the association that brings together addiction treatment professionals as well as preventionists and recovery support. Thank you so much. Have a blessed evening, a blessed morning, a blessed afternoon.